It's Wednesday, March 24. This is the news on PBCJ. I'm Simone Absalom Gill. Some Jamaicans will be receiving financial aid through the Constituency Development Fund. This was but one of several announcements made by Finance and Public Service Minister Dr. Nigel Clarke during the closing arguments of the 2021-2022 budget debates inside Gordon House on Tuesday. The funds are geared to help vulnerable groups as the country is to undergo 3 consecutive weekend lockdowns in a bid to curb the current COVID-19 spike.
In light of the program triple weekend lockdown, the government of Jamaica will provide support in aggregate equivalent to $2 million per constituency, but meaning that will have to take account of local government as well, right? Sometimes with the unknown constituencies, councils say, hey, what about me? So a total of $126 million through representatives to assist citizens during these weekends of lockdown. The provision will be disbursed through the CDF on the 1st of April. We'll have to work on the operational dynamics because I know people may need to move before, but given where we are at this point of the fiscal year, drawing warrants for that is not practical. But this is the policy intent, that funds will be made available to ease the burden that citizens face, the most vulnerable of citizens, over those lockdown weekends.
Prime Minister Andrew Holness announced the new curfew measures last Sunday.
After careful consideration and the need to restrict movement even further, except for essential activities, the following changes will be effected. From Thursday, March 23, to Friday, March 26, the nightly curfew hours will remain at 8 p.m. to 5 a.m. the following morning, ending at 5 a.m. on Saturday, March 27, 2021. So on Saturday, March 27, 2021, the curfew will begin at 12 noon and continue through the rest of Saturday and the entire day on Sunday. Let me say that again, the entire day on Sunday, and end at 5 a.m. on Monday, March 29, 2021. So, Holy Thursday, curfew starts at 8, but businesses would end at 12 to allow for shopping midday to 8. The curfew will extend throughout all of Good Friday and would end 5 a.m. on Saturday. On Saturday, April 3rd, the curfew will begin at noon and continue through the rest of Saturday, the entire Easter Sunday, and the entire Easter Monday, and it will end at 5 a.m. on Tuesday, April 6, 2021.
The current COVID-19 spike has again affected the ongoing school term. This is one of several issues discussed at Wednesday's post-cabinet press briefing.
What I do know is that through the Ministry of Education, Youth and Information, there was some funding made available to teachers, some teachers qualified based on certain criteria in the private, for the private schools. P.S., you have the number? You want to come say what those numbers are? And I do know that we have made good on that promise. And I'll ask the PS just to give the actual numbers.
Okay, so a total of 6,350 employees, teachers as well as administrative staff from both the private schools as well as early childhood institutions submitted information. From this number, 2,144 persons were deemed eligible and have been paid. We are currently in discussion with the Ministry of Finance and the Public Service regarding the additional persons who had submitted information to see whether or not it is possible for more persons to be qualified.
Jamaicans are being urged to adhere to the recently announced COVID-19 measures that restrict large gatherings and movement for the coming weeks. The matter and medical reasons behind the government's move were discussed at the Health Ministry's latest virtual COVID-19 conversation on Tuesday.
Minister of Health and Wellness Dr. Christopher Tufton says decreasing the number of positive COVID-19 cases depends on individual responsibility.
We are, in fact, our own undoing. We are, in fact, the cause substantially of the challenges that we're facing. And it's unfortunate. We complain when the restrictions are imposed, the most recent ones seeing a shutdown over the next 3 weekends, as announced by the Honorable Prime Minister. But the reality is that these are own goals, these are self-inflicted wounds, and it is extremely costly. It is costing lives.
The ministry's chief medical officer, Pbcjj McKenzie, says the most COVID-19 cases being confirmed positive are within the 20 to 39 age group.
Now, this suggests that within this age group, there's still quite a bit of movement, quite a bit of exposure and infections. Now, it is important for us to recognize that this is the age group that many persons will not get symptoms. So they do not appear to be COVID positive, and therefore they may not be taking the precautions. They are not adhering to the restrictions, and so therefore the potential of spread to the older age group who they may come into contact with. That is a very real possibility, and that is where we're finding that those persons, although less of them are being infected, the majority of those that are infected that lead to severe illness falls in that age group.
The CMO says while the number of positive cases are high in the 0 to 39 years age group, the case fatality rates are high in the 60 and over. She says persons with serious illnesses like diabetes are at a high risk of death.
98.5% of persons of the COVID-related deaths have had one or more comorbidity or risk factor. Most importantly, 73% of persons are 60 years and older. Again, the reason why we would want to have more decrease in movement among this age group, and certainly the other age groups that they would have to come in contact with need to take precautions, but also the importance of the vaccination of these age groups. We also see that in terms of cardiovascular disease, diabetes mellitus, and chronic renal disease, that we are seeing persons with a large amount of these diseases. Again, the importance that persons with chronic illnesses make sure that they are taking their medications, that they are controlled, and they're following up with the control of their illnesses.
Mrs. Pbcjj McKenzie added that due to the lack of compliance with safety measures, which has led to the increase of COVID-19 cases, hospitalizations has also increased over time.
We started out in March last year with 22 beds that were dedicated to COVID, and these were full isolation room. Over time, we gave the mandate that all hospitals should have converted wards into COVID beds, and we would have increased to about 380 beds over time. And that increase in the number of beds have kept us above the hospitalizations. So we were never at 100% occupancy of those COVID beds. Even when our numbers went up in September, October, our number of beds were always more. However, you will notice now that as of February, the number of cases that are hospitalized have gone above the beds that we have committed to COVID.
The CMO is urging Jamaicans to adhere to the safety protocols put in place by the authorities to stem the spread of COVID-19. Melvin Pennant, PBCJ News.
The Disaster Risk Management Act was established to enable the government to safely steer the country through natural disasters with preventative and reactive measures. Since the advent of the COVID-19 pandemic in 2020, the government has filtered its emergency responses through this act. However, Local Government and Rural Development Minister Desmond McKenzie admits that the law has to be amended to give the act more teeth. He says this is necessary because of the mass non-compliance with the government-mandated health protocols.
We have learned that while many of our residents, citizens, and visiting Jamaicans and overseas guests respect the orders issued under the Act to safeguard public health, there are still ways and too many who continue to demonstrate total disregard and, in some cases, encourage others to contribute to the threat of lives and to endanger many other Jamaicans. This reality also shows that the Disaster Risk Management Act requires amendments to ensure that the government of Jamaica can swiftly and comprehensively respond to any emergency, as well as to introduce a specific enforceable system of sanctions against those who continue to create chaos and confusion in breaking the various laws that are put in place to ensure that our public health protocols are maintained.
Under the amendment to the Disaster Risk Management Act, constables can charge offenders without a formal warning. The amendment also addresses how sanctions will be carried out.
When a constable deems that an offense has been committed, this includes serving of a formal notice, which essentially a ticket that specifies the details surrounding the offense. The notice also offers a chance of paying a fixed penalty for the offense within a specified period of time, failing which the notice becomes a summons to the court, a summons to appear in court to answer the charges.
A maximum of 30 days must pass between the date the notice was issued and the date that the fixed penalty is to be paid.
Anyone who has to face the courts for failing to pay the penalties will not be liable for conviction for the alleged offense if the fixed penalty is paid before the final judgment.
The fines, which are to be paid at a tax collectorate, range from $3,000 to $500,000. Justice Minister Deroy Chuck addressed some of the concerns posited by the opposition regarding whether or not the offense will create a criminal record.
Once the person is charged under this act, it's a regulatory offense. It's what you know, leader of the opposition, all lawyers know. They are considered to be quasi-criminal offenses, not intended to be a part of the criminal record. And that is the intention, and if it is not clear, we will clarify it when we go to committee stage.
The Justice Minister says the bill, once passed, will give security forces more power to enforce the law.
Because with this pandemic out of control in many communities, it is absolutely important for the security forces to be able to ticket persons who fail to comply. Because what is happening, Leader of the Opposition, before this amendment, security forces had to warn. And once they warn, the people just disperse. Nothing happens. And the security forces are saying, This doesn't make sense. What is clear, Leader of the Opposition, for 1 year, the warning has been given over and over and over. And therefore, Madam Speaker, with this bill, once passed and put into effect, the security forces will be empowered. So those people who want to keep their parties way into the night, those people who refuse to wear masks, to social distance, and who feel that they can go to the beach or to the rivers and have all their parties as they see fit. This country, Madam Speaker, needs some discipline.
Tourism Minister Edmund Bartlett has announced that due to the challenges posed by COVID-19, the organizers of Carnival in Jamaica will forego the annual road march and related activities for April 2021 until further notice. Senior advisor and strategist Delana Severite says Minister Bartlett has, quote, been in advanced dialogue with organizers of Carnival about introducing a bubble concept for Carnival in Jamaica 2021 within the government's wider discussions to reopen the events sector as soon as it is safe to do so, end quote. Organizers have indicated that all bands and fetes will honor all tickets and costumes purchased in 2020 for the next staging. After hitting a slump on Tuesday, global oil prices have edged back up. Here is the latest look at the market news. We get the business report with Carl Francis.
In Tuesday's trading session, the following reflects the movement of the JSE indices. The JSE All Jamaican Composite Index declined by over 2,000 points to close at 429,000 points. The Junior Market Index advanced by 35.57 points to close at just under 3,000 points. Overall market activity resulted from trading in 50 stocks, of which 22 advanced. 19 declined and 9 traded firm. Market volume amounted to 10 million units, valued at over $101 million. Wigton Wind Farm Limited ordinary shares was the volume leader with 2 million units, followed by Trans-Jamaican Highway Limited with 1.89 million units and the Siboney Group Limited with 1.8 million units. The US dollar on Tuesday, March 23, ended trading at $146.35, up by 10 cents, according to the Bank of Jamaica's daily exchange trading summary. Meanwhile, the Canadian dollar ended trading at $117.08, down from $117.80, while the British pound sterling ended trading at $201.47, down from $204.64. The euro lost $1.09 to trade at an average of $176.85. Oil prices rebounded on Wednesday as investors looked for bargains following the previous day's plunge, but gains were capped as pandemic lockdowns in Europe and a build in U.S. crude stocks curbed risk appetite and raised oversupply fears. Brent crude oil futures rose by $1.89 to $62.29 a barrel. West Texas Intermediate crude futures climbed $1.79 to $59.28 a barrel. For the Business Report, I'm Carol Francis in for Gabriel Thompson.
Pregnancy is perhaps the single most important point in a woman's life. There's much pain and much joy. Pregnancy comes with changes, flooding the body with hormones, progesterone and estrogen. And these can temporarily loosen the tissues and bones that keep your teeth in place. Aside from the teeth being loose, there may be even gum disease such as gingivitis. In today's episode of Living Healthy, HD's Jazz talks about good dental health for the expecting mother.
Today we're going to be talking about a new life.
Hello. Today we're going to be making breakfast and preparing a lunchbox for school. Let's start with some sugar and salt and wash it down with a nice big glass of more sugar. And now for the lunchbox. Let's put in saturated fat, more salt, and sugar. Foods high in salt, fats, and sugar increase the risk of hypertension, obesity, heart disease, and type 2 diabetes. Now more than ever, we have the right to know what's in our food. Give us warning labels on the front of our food packages.
I just love waterfalls. They symbolize a continuum of water that is fresh and new at every second that you're watching it. It reminds me of new birth. Pregnancy is a wonderful time in a woman's life, but it's also the time when she really has to take good care of her body. And one of the easiest, simplest, most efficient ways to do that is to have good oral care. If the pregnancy is planned, it's a very good idea to have a complete dental check and have all the decay restored, have all the gum disease treated before pregnancy. Because her immune system, that thing in her body that fights infection, is going to be fighting for two. So you need it to be as strong as it possibly can be. Soft deposits develop on our teeth every day, regardless of whether we eat or not. And if we're not able to adequately remove those deposits, they're a source of infection and inflammation. Simply brushing and flossing effectively on a daily basis goes a long way in keeping a mother healthy as she prepares for her child. However, many times that's not the case. And that accumulation of plaque, that soft buildup, can lead to tooth decay, and it can cause inflammation of the gums. Inflamed tissue bleeds. So bleeding is an indication that the gums are not so healthy. In the later stage, it can affect the bone support under the gums, and that is an irreversible situation. The bone that is eaten away will never grow back. In some mothers, it's not just that the gums get inflamed, but they may develop pregnancy tumors, just little boils that develop on the gums, and they never go away during pregnancy. After pregnancy, sometimes they go away, but sometimes they'll have to be surgically removed by a dental professional. Inflamed gums and bone that is eaten away are signs or conditions of periodontal disease. Periodontal disease also affects the mother and her child beyond the mouth. Inflammation traveling through the bloodstream can affect the baby. Inflammation can cause a problem, but also there's a condition known as preeclampsia in which the mother's blood pressure is elevated to the point that it's unhealthy for her and the baby. Either of those scenarios can lead to low birth weight babies because the babies are born before they come to term. Those babies that are always at a higher risk than babies who are brought to term. In general, it is best to avoid doing any kind of routine dental work in the first 3 months or the first trimester or the last 3 months, the final trimester. The safest place is in the middle term. Dental cleanings can be done anytime throughout the pregnancy. And of course, an emergency will have to be addressed at the time of need. But it's safe to say routine dental work should be done in the middle trimester. Pregnancy is truly a modern-day miracle, but there are some very simple yet important things that a mom can do to ensure that she and her baby are well protected. One of the simplest ways to do that is to practice good oral hygiene. Listen, catch us the next time on Facebook, YouTube, and Instagram. See you next time on HD's Jazz.
In regional news, we begin in St. Lucia. Public health authorities sat down with members of the Rastafarian community on Tuesday to discuss the COVID-19 vaccination program. The meeting was also intended to allay concerns of the religious sect, which has historically harbored reservations about the process. We get more in this HTS News 4 support.
The aim of a meeting between the Rastafarian community and officials at the Ministry of Health was to find middle ground in the vaccination campaign. According to President of the Ayanola Council for the Advancement of Rastafari, Aaron Alexander, the community has a long list of qualms. They include the terminology, vaccination history, and what he views as the historical wrongs exacted on people of color, as well as international accessibility.
We address issues of human rights. We spoke about human rights. We spoke about religious rights as well. We were very happy to hear the CMO state that the vaccine is voluntary, and currently there is no intention to make it mandatory. And we spoke about the issues of the COVID vaccine passports.
Alexander describes the dialogue as frank and open and applauded the Chief Medical Officer for her open-minded approach to engagement. He is urging officials to build trust with the Rastafarian population, underscoring the need for communication in order to foster buy-in in the vaccination drive.
Historically, as black people, we know that we were referred to as less than cattle. You know, we were looked upon as being property of people during the days of slavery. And when a slave ship would come to the Caribbean, you would hear phrases like, oh, here comes a herd of and now we're hearing about herd immunity. Why not population immunity? So some of the terminology, it is very offensive to people. So we have to look at those things, and not because America is saying it or other countries are saying it for us to, hop on that bandwagon. We must acknowledge our special experience, our unique experience we're coming from as black people, and the distrust, the historical distrust is deep-rooted and deep-seated.
Chief Medical Officer Dr. Sharon Belmar George characterized the meeting as informative and educational. She says the moment was opportune for dialogue with individuals with differing viewpoints.
It gave us a chance to actually listen to the concerns from their point of view. So in that way, we can better address our messaging when it comes to vaccines. I can understand some of the concerns that they have given the level of distrust in public health through history over the years. So we had to explain a lot of the measures in terms of the ethical approvals that now have to be put in place in relation to new medicines and also in terms of research. So it did give us an opportunity to clear up a lot of this, to clear up a lot of the efficacies, the safety measures that have been put in place with the vaccine, and also to give some updated information that was probably not very clear to them in terms of our rollout of the vaccine, and address a lot of their concerns in relation to the vaccine as well.
Following the nearly 3-hour-long discourse, the president of ICA has called for assurances he says will spur more participation in the vaccination program.
We need some level of guarantee that if the ministry is saying, well, there's a high level of protection and efficacy and they could vouch for the vaccine, then we're prepared to put probably some kind of disclaimer that whoever is inoculating you can sign that and say, well, like, I guarantee that the vaccine is not going to have any side effects and you're going to be all right. And things like a vaccine complaints unit.
Despite some misgivings, the ICA president says he will not dissuade persons desirous of taking the vaccine jab from accepting it. Rather, he will advocate for the personal rights of all individuals. It should be noted that healthcare professionals stress that the vaccination program is key in the fight to defeat the pandemic and return the planet to some semblance of normalcy, given the unprecedented public health and economic disasters caused by the COVID-19 virus. Solange Alfred, HTS News Force.
In sports, volunteers from abroad will not be allowed in Japan for the postponed Tokyo Olympics. That's according to organizers. The announcement came Monday, 2 days after Tokyo organizers said they would ban international fans from coming into Japan. Both measures are aimed at preventing the spread of COVID-19. Organizers said a limited number of volunteers might be allowed if they have special skills. The organizer said, quote, "I'm really sorry, but we have to decide. There is no other choice but to drop the plan." That's according to Toshiro Moto, the CEO of the organizing committee. The organizers had a plan to use about 80,000 unpaid volunteers. The Tokyo metropolitan government had lined up 30,000 more. Most, of course, are from Japan. The horse racing fraternity has been plunged into mourning following the death of 18-time champion trainer Wayne Anthony DaCosta. He died in hospital Wednesday morning after losing his long battle with COVID-19. DaCosta, who was involved in the sport for over 40 years, redefined the sport with his many achievements. He won the trainer's title 18 times and the Triple Crown 2 times. We here at the PBCJ extend condolences to his family. And on that somber note, we bring the newscast to a close. Thanks always for making it PBCJ. Pleasant viewing.